Well, thank you very much for the introduction. I had a 6 a.m. flight this morning out of Albuquerque, which those flights should be illegal if you ask me. But yesterday I had the pleasure of sitting on a panel at the Conference of Western Attorneys General with your Attorney General, Tom Miller, as the moderator. And we had a great discussion that ended up going about an hour and a half about healthcare fraud, which, since we wrote our book last summer, we've asserted that there's $70 to $120 billion stolen out of Medicare and Medicaid every year. And we've had no one push back on that. In fact, about the week before my book came out, President Obama, in his speech to Congress, September 9th, 2009, said there are, quote, hundreds of billions of dollars in waste and fraud in our health system. And that was the best possible marketing tool we could ever have. So thank the president for that. And then the following month, 60 Minutes had a segment that ran on October 26th that I would encourage anyone to watch, that Steve Kroft did, that he asserted $60 billion stolen out of Medicare every year. And he interviewed some people, especially in the South Florida area where it's prominent. So this is an area we've done a lot of work on, and there's certainly a lot of room for bipartisan cooperation because reimbursement rates, access to care, everything is affected by how easy it is to steal from these programs. To be a supplier to Medicare, you pretty much need to have a pulse. And I say that only half jokingly. Having spent a year and a half on this topic, it is unbelievable how easy it is to steal from these programs. And Congress is starting to pay more attention to it. I think the current legislation that passed in March and signed in March missed a huge opportunity to take more advantage of this issue. But I wanted to just throw that out there because something I've spent a lot of time on, and I think almost everyone should have a serious concern about. But in my short amount of time, I just want to walk through 10 specific issues that I think are of concern in the new legislation. And we'll start with the first one, and this is the one line that every American has heard 100 times, which is, if you like your health insurance, you can keep it. Everyone's heard that line, no matter who you are, no matter where you live. If you like your health insurance, you can keep it. That's not true. And it'll become less true every day and every year that goes on. The chairman of the House Energy and Commerce Committee in Washington, Henry Waxman, was going to have a hearing in April to look at why some large corporations were dropping their prescription drug coverage. And it turned out they were being very adherent to SEC guidelines, so the hearing got called off suddenly at the last minute because these large corporations were doing the right thing in this regard. But in summoning the document and some of the internal emails, there was discussion, and these are large companies, John Deere, AT&T, Verizon, internal discussions talking about how we need to drop health insurance coverage. And there was an article in the Boston Globe just yesterday, just 2 days ago, where Massachusetts being the one state with an exchange, so that's perhaps a mine canary of what we're getting into. Small businesses are getting out of it actively, and there's a growing consulting business teaching small businesses how to get out of health insurance and get their employees into state-subsidized coverage. So the idea that you'll keep the health insurance you like is just not accurate, and it's going to be less accurate and more obvious to everyone as time goes on. And you actually have a rather perverse piece of it where the sliding scale, where above 400% of poverty you don't get any subsidy, which is about $45,000, and the previous speaker said for a family of four it's $88,000. So let's say Iowa has an exchange, and for a single person it's $4,000 for a policy, and say $10,000 for a family policy, which are low figures, but let's take those for argument's sake. If you're a recent graduate from the University of Iowa, engineering degree, doing pretty well for yourself, you get a new job, $50,000 a year, whoa, suddenly you got to pay $4,000 for your health insurance with no subsidy whatsoever, and if you don't pay it, you get a $2,000 fine. And that's going to be pretty shocking to a lot of people when they start realizing how big a deal that is, and with families too. And you actually have a situation where, there's quite a few instances where this is likely, where if, let's say, a family has a combined income of $40,000, and let's say a spouse or whoever the earner is suddenly gets a raise to $50,000, the loss of subsidy for their health insurance could actually offset the raise to the extent that getting that raise would actually result in a decline in after-tax income. That's called the poverty trap. So there's actually disincentive to work harder and do better because you lose your subsidy and your after-tax income actually goes down. And there's a lot of scenarios where that can actually happen. Number two, and this is an issue that gets so little attention, and it is actually the number one most important issue. You don't have a healthcare system if you don't have doctors. I know that may sound a little pedantic, and yeah, we understand that. You don't have a healthcare system, you don't have doctors. Doctors are not fans of this new law. And I would strongly encourage you to not take my word for it, not take anyone who's talking here today, not take their word for it. Go ask your physician what he or she thinks of more and more of their patients going into the Medicaid program, which is the lowest payer in the system. They're not happy about it. There's actually going to be a doctors' tea party all across the country on August 7th, where doctors are going to talk about their concerns with the bill. In Texas, doctors are already talking about not participating in the Medicaid program. There is no law that says doctors have to participate in Medicaid, and as rates go down, access for low-income people evaporates because they're just not going to play. That's a serious, serious problem. So what's the solution from some? Now, fortunately, no state has actually done this, but in Massachusetts, a state legislature has actually suggested that licensure of physicians be tied to accepting Medicaid and Medicare. Now, I don't wish ill on the people of Massachusetts. I really don't. But if that passes, I guarantee doctors will get out of that state so fast you won't believe it. And I don't want to see that happen to people in Massachusetts, but that will happen. It's a terrible idea, but that's exactly, if you squeeze them enough, they won't play ball. And you don't have a healthcare system, you don't have doctors in it. So states are going to be left to compete on the working environment they have. So one thing a state like Iowa might want to do, which is what Texas did in 2003, was pass some very, very serious medical malpractice reform, which in Texas, since 2003, they've added over 15,000 doctors in that state. They've come in from other states, they've set up shop as new physicians, and they've gone specifically into high-risk specialties like OBGYN and neurosurgery. They've gone into underserved areas like the Rio Grande Valley and other places. But Texas has a much better environment. Medical malpractice premiums for doctors have gone down by half in 7 years, which is pretty significant. They did the right thing in Texas, but they actively recruit in Oklahoma. You take our lawyers, we'll take your doctors. And they were that blunt. And it's worked. And that's what states are going to have to do now to compete, because the physician shortage is real and it will get worse, especially as our population ages. Number 3, will this legislation cut the deficit? Now, nobody believes that. Poll after poll after poll shows in the neighborhood of 70% of Americans don't think that's true. It relies on a number of accounting gimmicks, the first being that there'll be a 23% cut in Medicare reimbursement rates in the next couple of years, which everybody knows won't happen. Why? Because it's never happened, even though it's supposed to happen every year. It will not happen. The 10-year budget score that CBO has is only 10 years. Most of the expenditures of the bill don't actually start kicking in until about halfway through that window. After 10 years, these costs explode off the charts into the trillions of dollars once everything is phased in. So if you assume a 23% in Medicare and if it cut in Medicare reimbursement rates, and if you take out the fact that most of the costs don't really start kicking in for another 5 years, the initial 10-year budget window may be deficit neutral or close to it. But beyond that, it just explodes. And we'll come back to that too. In fact, the CMS chief actuary, Rick Foster, has said that, and he's been roundly ignored, and he was very critical of the Republicans' prescription drug plan back in 2003 as well, so he's managed to annoy both parties over the years, which is probably a good thing. And the one other thing, this is just worth saying, government estimates, in 1965, Medicare actuaries said that Medicare would cost $9 billion in 1990, and it cost $65 billion in 1990, so they were off by 7 times. So that's about how good the government is at estimating how these things play out. The cost to the states, also much, much higher than people anticipate. In Louisiana, they just did a study that the Mercer consulting firm was involved in, and in Louisiana, they think the cost will be $7.3 billion just in the next 10 years for dramatically expanded Medicaid and others. Indiana just came out with a study the other day where they found their estimated costs will be significantly higher than what's been told to them because the administrative costs of these programs are so high. People have to hire so many people. There's so many things that haven't been taken into account in the studies done thus far. So the states, as they start looking at this, are starting to say, whoa, we kind of were worried about this, but this is worse than we thought. Texas actually has to add 2 million people to their Medicaid rolls. 2 million. That's a lot of people. And in some states, that's the highest as an absolute number. Number 5 is this bill just builds on old models. It builds on insurance models. It builds on Medicaid models. It's sort of interesting. There was an amendment introduced in the House Ways and Means Committee last summer that said the first people that have to join the then public option would have to be members of Congress. It was voted down on party lines. Democrats opposed it. They want to create a public plan for some people. They didn't want to join it. If you're going to create something, you should join it. We happen to have health savings accounts at my business. I've had one for 5 years. It works very well. That's been the most innovative product, the most popular product in the last 6 years. It's grown 30% a year for the past few years. There's 10 million people in HSAs now, and they've worked quite well by actually engaging people in the right way. Price controls never, ever, ever work. The only thing that can work is changing people's behavior, and you can do that by creating the right incentives for it to happen. Imagine if tomorrow the government, Congress decided that iPhones are so important, everybody needs one, but Apple can only charge $50. Nobody thinks that's sane, and nobody thinks that would lead to better services of higher quality at lower prices. It just wouldn't work, but that's exactly the logic we're applying to our healthcare system. It won't work there either. Number 6, the individual mandate, which is something that's been discussed a lot. There's been some disagreement among people with legal backgrounds on whether or not that's constitutional. The Congressional Research Service, which everyone concedes is the gold standard, cannot confirm that the individual mandate is constitutional. So now you have 20 states suing the federal government, and many of those cases are different. Virginia's is different than Florida's, and there's a whole bunch of various angles on it. But there's a reasonable chance, and I don't think we'll know until the Supreme Court decides, but there is certainly a chance that the Supreme Court will rule it unconstitutional. And the analogy with states requiring people, it's the same as people requiring people to, as states requiring people to buy auto insurance, is just ludicrous. States, first of all, are not the federal government, and states can require people to buy auto insurance for the privilege of driving, and that's fine. No one concedes, and I think 48 states have that now. Congress requiring people to have health insurance because they're breathing is completely different, and it is unconstitutional, and we'll have to see how it turns out. And it'll take a couple years before there's a final ruling on it, but that is a serious issue. It has to be looked at. And the IRS is indeed hiring hundreds or thousands of people to help enforce this mandate, which I think people aren't going to be real happy when they realize they get a $2,000 fine or pay $4,000 or $10,000, whatever it might be, for an exchange product in their state. Number 7 is this thing called the Class Act, which I think some people may be familiar with. It's sort of a tax, if you will, to help pay for long-term care services. So people would have to pay, people, of course, the fee starts right away, and the benefits don't start for another 5 years. But Kent Conrad, who is the Democrat chairman of the Senate Budget Committee, called it a Ponzi scheme that would make Bernie Madoff proud. And the CBO said that after the year 2029, the expected revenues are far, far short of the expected outlays. So that's a big piece of the puzzle that I think is just simply not going to work. Number 8 is Medicare Advantage. My parents just happened to enroll in Medicare Advantage recently, and they seem to like it. I think a lot of seniors do. 10 million seniors voted with their feet to enroll in Medicare Advantage. 40% of African Americans, 50% of Hispanics are in Medicare Advantage, and it's going to be whittled away. Millions are going to lose their coverage, probably sooner rather than later, and the plans allow people options, and they allow significantly better benefits and more coordinated care. And we'll see over the long term if that program survives, but it has been popular simply because people have opted to be in it. That's a good thing. Options tend to make people more powerful. Number 9, and this one has been tremendously overlooked, and I know there's a lot of state policymakers in the room. I've been told by people in other states that this should be the most terrifying piece of the bill. Now, I'm not a lawyer. I'm just repeating what I've heard from people who tell me this. There is a sentence in the legislation that says the state, instead of 50 years of legal precedent, which has been to pay for the financing of healthcare services, now must, quote, ensure the provision of healthcare services. Now, what I'm told is that is a wide open door to various physician groups and others suing the states, demanding higher reimbursement rates and winning. Ensuring the provision of services is very different than financing care. So again, this is an issue that's been raised by some people. I would very strongly encourage people to look at it seriously at this state, because a lot of people have looked at it in other states are very, very concerned about it, because states could be on the hook for hundreds of millions or billions of dollars they didn't have, and it's a wide open door to lawsuits. So it's just something that needs to be on the radar screen. And number 10 is this legislation passed, as everybody knows, along very strict partisan lines, although not strict partisan lines, because in the House, 37 Democrats voted against it. Major legislation in our Congress and in our history has always had bipartisan support. The Civil Rights Act, welfare reform in 1996 had 100 Democrats in the House vote for it. In the Senate had 77 total votes out of 100, including John Kerry, voted for welfare reform. This bill is strict partisan lines, which for a major, probably the most impactful legislation of the past decade or more, doesn't have a cross-partisan legitimacy. And that is why, with every poll that comes out, high 50s to low 60s% of likely voters support repeal, full repeal. It's just a fact. That's what the polls say. And in November, we will see what happens. I have a standing $50 bet with any of my friends. So far, I've had one taker. The Republicans pick up 50 seats in the House on November 2nd. They need 40 to take control. I think they'll get 50. There are models where it could be 75 or 80. There's a real chance it'll make 1994 look like a ripple, because the outrage, especially over this bill, is very significant. People don't feel like their voices were heard, and they're starting to understand things like, if I like my health insurance, I can keep it, isn't quite valid. Now, those are 10 things to think through. As you may have noticed, I didn't mention taxes. That could easily have been on the list too, but I didn't need to include that. I think the 10 that were listed there are pretty serious and worthy of consideration. But the taxes on pharma, on health insurance, on medical devices, one of the things that Americans are very, very good at is medical devices. And that's a big export industry for us as well. There's now a 2.9% tax on medical devices, which we're penalizing industry that's done very, very well and is a huge job creator, especially just north of you in Minnesota and a lot of other places, Massachusetts and other states. But I think there's a very, and what's going to happen? So let's assume next year it's January and Republicans have the House and maybe the Senate, or within 1 or 2 in the Senate, which is probably a plausible scenario. What's going to happen? Well, there is no chance it'll be repealed next year, because the president would certainly veto it. But Republicans can do, and this is what they've talked about doing, is just not funding big portions of it. In the Constitution, it says all appropriations start in the House. So all they got to do is just pass legislation that doesn't fund the 159 new government agencies created by this bill. And with the new members that are running now and campaigning now, I think that's a very likely scenario. So we have a chart actually on our website, healthtransformation.net, that shows the 159 agencies, what their names are, and what their objectives would be. But there's very good chance that the new Congress just chooses not to fund it. I do think that this bill, whether or not it gets repealed in 2 years or 4 years, I don't know if it'll necessarily get repealed in its entirety, because there are pieces of it that do have majority support. But when you look at the polling and see there's never been a major piece of legislation that was passed with overwhelming negative polling from the people that has continued well past it. Welfare reform, going back into the 80s and 90s, or beyond that, or further back than that, there's always been supportive at the time and supportive after, and support has grown. In this case, it's absolutely the opposite. Now, everyone always says, once something is passed into law, a new entitlement program, it can never be repealed. There is one exception to that. It's the Medicare Catastrophic Act in 1988. Some of you may remember that. It was a bill that was going to provide senior drug coverage in Medicare at initially it was supposed to be a $5 a month fee. Well, seniors got wind that they were going to start paying a fee and not getting their drugs. Even though the bill passed with something like 375 votes, within 18 months it was repealed by the same lopsided margin, because people were so outraged once they took a look at it. So our precedents for major legislation being repealed, I don't know if this one will, but I can say it's very unpopular, and I think as people learn more and more about it, the popularity will continue to decline. But with that, I very much look forward to your questions and your continued discussion both today and well beyond. Thank you very much.